Tell me a little bit about the program that you run and where you're from.
I'm from the city of Chicago, Illinois, and I run the University of Illinois Miles Square Health Center, uh, Community Health Center. We are one of the oldest community health centers in the United States, reaching 43, 45 years of age, and have been at the almost at the very beginning of the health center movement. We have presently 11 community health centers in our network. Those health centers, we have 4 regional health centers which serve rather unique communities, very different, distinct, unique communities, 4 school-based centers, and 4 centers that serve patients who suffer from chronic mental illness, which we're very proud of.
All right. Now, tell me a little bit about, in terms of how you feel, or what the importance is of these centers, having them in these communities.
Absolutely. Our strategy has been to be in some of Chicago's most diverse economically distressed communities. So we have done data to look at where the greatest needs are. And we placed our centers in communities like South Shore, Back of the Yards community, which is a highly immigrant population where in fact more immigrants come to Chicago to that one community. So we put a major center there, Cicero, and our major site on Washington, the anchor site on Washington Street in Chicago on the west side.
So tell me what the importance is of these centers in these communities.
Indeed.
What does
Indeed.
it mean to them? What does it mean
Indeed,
to have them there?
indeed. What happens is you are able to provide high-quality community health center, community care within the community. Patients can get primary care, academic health care within their communities. They don't have to go downtown or go outside of their community for care. That does 2 things. One, that says we believe that providing and improving the outcomes in an individual community is important, that we believe that this care should be convenient to you and that is available to you. Not every resident, not every person believes that they're entitled to or uses health care in the most efficient way. Having community health centers in the community enables the individuals to get the care they need in a way that's culturally competent for them as well.
All right. Have you been able to get any feedback from the folks you serve? Are they happy with it? Do they feel like it's providing them with a sense of personal pride that they're able to now get these kinds of services?
Indeed, because we have a community board of directors that help guide us and help us set priorities in our centers, that we do get constant feedback. And one of the items, the value of having the board, it ensures that we continue to stay in touch with the needs of the community so that their issues become primary. In terms of getting also outcomes, in terms of the value, we've recently received an award from the state for providing and getting better health outcomes for patients with cardiovascular disease. So we can promote and say to our community concretely, not only are you getting high quality health care from our perspective, but we've been recognized for getting good health outcomes in terms of improving health for this population. One of the things that we want to be known for is managing large populations of patients and being able to improve that we're managing and improving the quality of their life and health.
What partnerships and collaborations have you used to help you along to your goals?
The collaborations and leveraging resources is vital. One of our major partners is with the Chicago Housing Authority, specifically as we look at patients living in public housing. We know throughout the United States there are approximately 7 million individuals who live in public housing or receive housing vouchers. That population tends to be the most vulnerable, have the highest outcomes in terms of poor health and violence in their community. So important that we partner with many agencies in order to address key specific issues that create ills in the community. One of the items we're currently working on and have been working on with the Chicago Housing Authority is establishing community health centers in Chicago is the medical home for this population. That does 2 things. Says there's an agency that wants you as a partner, wants you as a patient. So the concept of feeling that I'm not wanted in these major academic health centers or in the doctor's offices is dispelled. We want you. So by working with the Chicago Housing Authorities and say we as community health centers in Chicago want to service your medical home provides a sense of welcome. Also being able to demonstrate that when becoming part of the medical home, their needs and issues become our highest priority, and being able to demonstrate by staying with us, your health, if it's diabetes, cardiovascular disease, if it's hypertension, will improve because we'll work with you. Now, when we say work with you, we mean that we'll not only work with your illness, but we provide enabling services that allows you to become more healthy. For example, patients who are high risk often have a number of social issues that affect them and that make it impossible or difficult for them to get to the doctor's office. May it be transportation, maybe issues with trying someone with babysitting issues, maybe be the hours in which the clinic is open. So part of what we try to do is try to understand what those barriers are and how we might develop systems to abate them. The other piece is we want to focus on wellness and prevention as best as possible and get our communities to start looking at ways in which they may be able to have some control and self-management in terms of changing their behavior to improve the health of their individual health. Also, we have been very proud of our lactation program. We have a very large percent of our population at Miles Square who breastfeed, which we know improves the health of the baby who's new to this life. So there's some health education that we do to sort of promote that, so we get our babies starting off on the right foot.
Right. And finally, are there any particular, either specific or general success stories that you can tell us that you've been able to accomplish?
Indeed, many. I mean, most of the time could be spent talking about the success of the health that we've been able to improve in the community. One, individual stories of staff of patients who have seen their diabetes improve. In our practice, we have a very large quality management program, and we manage most of the chronic illness by looking at the data. We've seen that 65% of our patients within our diabetic population are under control, looking at that number increasing every year. That means there's an active process, an active strategy for getting those patients into care, making sure that they get back to their appointment as best as possible, and ensuring that they take the medication regimen that we know will help improve their health. Sometimes the barriers that face our patients are ones of pride and not wanting to let you know that they don't have the money to pay for their medication. So one of the things that we feel is very important is our ability to ensure that patients leave with their medication and understand how to use their medication, and they're not making bad choices between not taking the medication every day because they can't afford to have the medication every day. So it makes no sense to us to do medical intervention without having them have the therapeutic medication to continue with their treatment at home. We have staff who follow up with our patients when they're back at their home to sort of get them back into our treatment and ensure how they're doing as they follow through. We focus highly on our diabetic population. Our cardiovascular disease patients is a priority for our center.
Right. And if you were talking to a congressman, a Republican congressman, who was interested in, stripping some of this funding away, what would you tell them why it was wrong to do?
It would be a travesty, sort of bad policy and being short-sighted. We know the country's in a very difficult position right now only for this moment. This moment will pass, but we must look down long term to see cuts in this program will only set us back in terms of adding more costs to our health care program. We know the Community Health Center program works. We know it saves the country money. We know absent of this program will just force patients to use more costly methods for seeking health care. And that's the strategy we should be all looking at. How do we avoid costs increase and put patients into an environment where they get the most cost-effective care that saves the consumer and the taxpayers money. And it's been proven that community health centers save money in terms of providing care. It's better for the patient to get the care in the community health center versus getting the care in the emergency room. Okay? All right, thank you.
Thank you very much
Thank
for
you.
your time.
Thank you.
Thank you.
Thank you. All right.